Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Across the nation, this has been one rough flu season, and it's not over. The Centers for Disease Control says that while the numbers have started to level off in the East and the South, they're still rising in the West. The percentage of flu-related hospitalizations and outpatient visits both qualify as an epidemic. And while there are no nationwide systems to accurately count flu-related fatalities among adults, the number of children who have died is now approaching 40. What makes this flu bug, or rather bugs, plural, so bad? And what can you do to help protect yourself and your loved ones? Here to discuss the situation are Dr. George Allen, PhD, Director of Infection Control at SUNY Downstate Medical Center, and Dr. Nicholas Vicari, Assistant Director of Emergency Medicine with New York Methodist Hospital. Thank you both for joining me.
Thank you.
So let's just talk about the bug and what you've been seeing.
In the emergency department at New York Methodist Hospital, we've seen almost a 20% increase in flu-like illness admissions to our emergency department since probably around the 20th, 21st of December. And it has sustained a volume of 20% increase over what we usually see since just up until about last week, where we're starting to see that fall off.
It is starting to level off.
It's definitely starting to level off.
So my other question about the volume is, are you seeing the usual presentation, or are there various presentations of whatever these bugs are?
Well, we are seeing a combination of both. We are seeing the usual flu-like symptoms, sore throat, fevers, generalized aches and pains. We are also seeing almost some gastroenteritis symptoms.
Would you just explain gastroenteritis
Absolutely.
symptoms?
So people who feel a certain amount of nausea, vomiting, diarrhea, fever, aches, pains.
And it's not the usual coughing thing, then? It's all
Correct.
Stomach and intestines.
Correct.
Well, it must be really different when we're talking about inpatient. What are you all doing?
The admission process, again, generally, if patients have comorbidities with the influenza, the typical symptoms are fever, very high fever, and aches. They may also have some other comorbidities that requires them to be admitted, and that's when generally they are admitted. Generally, we don't admit patients who just has the flu.
Right.
Usually would give them some medication and send them back home.
What kind of precautions are you taking, though, once you do have to admit somebody who...
Well, the precautions are taken even before we admit them. Typically, droplet isolation precaution is the category that is used.
I love your term, droplet precautions, but we're going to have to break it down
a little bit.
Yeah.
Basically, as you all know with flu, when people cough and sneeze, you expel large amount of these particles. They land on surfaces, so these are droplets that land on surfaces. And an individual who touches this may pick it up in their fingers, or it may actually land on a mucous membranes, which is your eyes, your nose, and your mouth. Also, if you touch one and you touch your nose and the mouth, that's how you get transmission of the influenza virus. So the precaution is droplet precaution, meaning that you're trying to control the spread of droplets.
So all those people that are coughing next to you on the subway.
And cover your nose and sneeze when you're coughing. And I know the Department of Health has a wonderful program where you sneeze and cough in the crook of your arms. And I'm sure my colleague here has some wonderful...
way to remember that.
Yes.
Sure.
Yes, I would like you to tell us what that is.
A lot of times, a lot of the treatment is focused around symptoms. And what, we do in the emergency department is a lot of education, especially with pediatrics. So what I try to tell them is just the Dracula. Put the Dracula cape right up to the
I love the
right
Dracula
up to the cough.
move.
Can I see you do it?
You know, the thing that you said is a lot of what you do is education. And so what we want to do is to make sure we spend enough time talking about what people should do before they get the flu, and maybe it will help them not get the flu. Mm-hmm. So let's talk about the education. Let's start with what?
To keep it simple as possible, wash your hands. Wash your hands.
And wash your hands again.
And wash your hands. And you know, you could also use the alcohol preparations that you can buy in the drugstore. And, you know, consistently throughout the day, keep in mind that the things that you're touching, many other people have already touched.
Right.
And those germs are being circulated throughout our community. And by washing your hands, you're protecting yourself and you're protecting your neighbors.
So that's... hand washing is a big deal.
Right.
What else can they do?
Not only for the flu alone, hand washing is absolutely important for the preventing the transmission of any kind of infection. But specifically for the flu, what you as an individual can do or should be doing every single year is getting vaccinated every single year.
Well, I'm glad you said that.
There's a different vaccine every year. And you need to get that vaccine every single. That's the most important thing you can do.
Do you know that the percentage of people who should get vaccinated and the percentage who do differs by about 65%? Only about 35% of people who are indicated to become vaccinated. What do you hear as the reason that people give for not wanting to get the vaccine?
I think the most popular response that I get is that I don't want to get sick today. So they don't want to take that flu shot that day because tomorrow they have a presentation at work, they have a very important meeting, they have the kids to drop off at school, and you know, there are a myriad of excuses that people will use.
Why do people say they don't? What else have you heard?
Well, again, one of the things that I hear all the time is that I took the vaccine and I got the flu. That in these modern times is impossible. The vaccine that is formulated, that is used most often, the intramuscular vaccine that is administered in the deltoid region of your arm, is a killed virus.
Killed virus, absolutely. You tell people that over and over again.
Right.
But you mention injection.
Right.
People sometimes, as a matter of fact, I will just tell you, the person that I know, I think I've only had one person faint on me when I gave them an injection, and he was 6'5". My exam room could barely hold him. There are people who are phobic about needles. But we have a solution for that, right?
Right, there's the intranasal.
The intranasal. Right. And so the intranasal should be offered to people who are phobic about needles if you are over
2
and under
50.
So there you are. For all of you who are phobic about needles, you can take the flu mist. That is a spray into the nostrils. Right. What else do people say?
What else?
I never get a cold. You ever hear people say that? I never get a cold, I don't need it.
I don't need is also a very popular excuse for not getting the flu vaccine.
I also hear is that the flu vaccine is not effective. There is data from the CDC, and New York State put that data out also, that the flu vaccine is about 65% effective. So if you do get the flu vaccine, 65% of you will get adequate protection. The important thing for people to remember is that it takes time after you get the vaccine before the protection begins or kicks in.
So where we are at this point with the epidemic sort of on the wane, and we've had a lot of the flu season has come and gone, is it still advisable for people to take the vaccine or the flu mist?
Absolutely. Absolutely. So a lot of times you'll see two different, almost a bimodal transmission. So, you know, I wouldn't be surprised that towards the beginning of spring if we would see another resurgence of this flu or maybe very similar flu to this.
In fact, you can see cases up until May, probably.
Absolutely. So people should know that if you've not done what you should, go and do it now, because it can still be protective after. And
vaccines are available.
Mm-hmm. And vaccines are available, correct. The other point that we need to make sure we clear up is that the flu vaccine may not protect you completely but it does, for people who get it, still have benefit. Could you talk about that a little bit?
Well, I think that the benefits by far outweigh the risks. And when making decisions about just about anything in life, you have to weigh those two.
Right.
And, even though, like the doctor said, it's 65% effective, and you may have had an anecdotal story about a family member who took it and got sick anyway, the chances of you having a better outcome, becoming less sick, and less likely to transmit that virus around the community are greatly reduced by getting the vaccine.
Because some of the complications of flu, right up to and including pneumonia and hospitalizations, are very serious, and the flu including death, helps to protect you. And one last thing that we have in the minute left, what about the people who say, I don't go out during the winter, I never go into crowds, I never go anywhere. I stay home, I'm the grandmother, I don't go out, my children do all the going out for me. So what about them? What can we tell them?
Well, we could tell them that that their life they think it is not in a bubble.
That's right.
And they are exposed. And really, just like I said earlier, is that we saw the amount of people that came into the emergency department at New York Methodist Hospital was dramatically increased, that we had to actually open up some of the floor and the clinics upstairs that greatly helped take that burden off the emergency department. So it is there. The numbers are there. Go get the flu shot. Don't worry about who you're coming into contact with. You will be exposed by your grandkids, by your children, by your friends, by taking the subway, by turning doorknobs, whatever it may be. Go get the flu shot.
Right.
I think we're going to leave it right there. A good place to leave it. Thank you very much.
Thank you.
Watch this and other Brooklyn Independent Television episodes online at bricartsmedia.org/BIT.